there, my name is Dr. Megan Yim. I'm a chiropractor here at VitaCare Natural Health, and today I am interviewing Dr. John Yim. He's been involved in the health field for over 40 years. He started his career as a massage therapist, practiced for about 7 years, and then was really interested in expanding his knowledge, expanding his education. He decided to go to Bastyr University down in Seattle and has been practicing as a naturopathic doctor in Nanaimo for the last 28 years. One of his passions is teaching, and besides doing that, working one-on-one with patients, he also loves sharing knowledge through approaching larger audiences through television, radio, print, and most recently, podcasts. Although Dr. Yim's practice is general and treats many of the same things as a family doctor would, he also has areas of special interest, including allergies, autoimmunity, arthritis, and the gastrointestinal system. This is particularly interesting for today's topic, where he will be focusing on the connection between the gut and the skin. So to start off with, Dr. Yim, why did you choose the gut and digestive system as your particular area of interest?
Well, my friends and family will tell you, I am highly motivated by food, and eating is one of my passions. So it makes sense that the system that's most involved with processing that food would be the system that I'm most interested in. And I think that, all the organs, all the systems of the body are important, but my feeling is the digestive system is uniquely important. It has to break down and digest your food, absorb nutrients, process those nutrients and get rid of your wastes. So every other system of the body is totally dependent on your digestive system working very well. The three main functions: absorption of nutrients. So people think that as long as they're eating healthy and taking supplements, that they're going to have good health. But what I want to tell you is that you have to be digesting and absorbing those nutrients. Otherwise, all that goodness is just passing through this hollow tube that's running through from your mouth down to the other end. Second thing is protection. The gut's a barrier. And, it has a surface area of 2 tennis courts. So it's a huge battlefield. And there are all kinds of bacteria and fungal organisms, possibly even parasites that are in the intestines. And if the gut lining is not working properly, and the immune cells, the friendly bacteria, that nice layer of protective mucus, if those components are not working properly, we would all be, suffering from gut infections and possibly even dying. And then the third important function is obviously getting rid of waste products. You can imagine in your beautiful city, if the sewage is backed up, or the garbage pickup was not longer going on, the city would no longer be very clean and beautiful. And it's the same with your body. If your elimination is not working very well, you're going to get toxic really soon. So these three important functions determine our health. Many chronic diseases that I see in my practice are either caused by or contributed to by a poorly functioning digestive system. So that's why I feel that the digestion is so important, and that's my focus.
Yeah, absolutely. So how in particular is the gut and the skin connected?
Well, when we are, a one cell organism and cells are dividing into 3 primal layers, the gut and the skin both derive from the same tissue, the ectoderm. And so as an adult, or a full-formed person, the gut and skin, because they come from similar tissue, they have similar functions. I mentioned that the gut acts as a barrier. So does the skin. So the skin acts as a barrier from the external world. The gut is your internal barrier, keeping things out of the bloodstream that shouldn't get through. They both absorb. We know that the gut lining absorbs nutrients, but we forget the skin also absorbs. That's why nicotine patches, transdermal hormone creams, those things work because our skin has the ability to absorb. And finally, we've got to remember that if the skin can absorb, we've got to really be careful of things that we put on the skin. Things like cleaning solvents, even body care products that have chemicals that aren't good for us, those things can absorb right through the skin.
Mhm.
So, there's a huge connection. They're very similar. And so anything that affects the gut in a negative way can end up impacting the skin. Good example is celiac. When people have celiac disease, they're not absorbing nutrients very well. So a deficiency of certain nutrients that are important for the skin can end up causing skin rashes. So primarily a gut problem manifesting on the skin.
Hmm. Interesting. So if the gut acts as a barrier, what happens then in the case of leaky gut and its effect on the skin?
That's a great question. When I first heard the term leaky gut, my wild imagination, I saw this big tube and like a colander, when you put cooked pasta in, all the water streams out. I had this image of this gut leaking all this stuff out, right? And it's almost like that. So leaky gut, what that means is the lining, especially the small intestine, is more porous or permeable than it should be, right? The lining, the gut, the small intestine is about 20 feet long, but it's one cell thick. And it's that thin because nutrients have to diffuse across that lining.
Mhm.
Now, the cells of that lining are tight up against each other, causing what we call tight junctions. Leaky gut, those junctions, instead of being nice and tight together, they're now gaps between those cells. And so things that should not get through, things like toxins, especially bacterial toxins, large proteins, and even microbes themselves, even bacteria and fungal organisms can stream through the gut into the bloodstream if the lining of the gut is too leaky. And this condition can lead to all kinds of problems in the body because once these things get into the blood, they can be carried anywhere in the body. So it can cause systemic inflammation. It can lead to things like depression and neurodegenerative problems. It can lead to joint issues, skin issues, especially acne, psoriasis, rosacea, eczema. All these 4 skin conditions have an origin in the gut. So when we have leaky gut, we think, oh, everything's getting through. No, things that shouldn't get through the gut lining can, but the nutrients that should get through are not getting absorbed well. And just to give you a really quick case here, I had a patient that was 35 years old, complaining of headaches, and she had skin issues. And her third symptom was she had difficulty gaining weight. Just imagine, right? Difficulty gaining weight. Well, her history set her up for all these symptoms. She had tummy aches when she was young. When she was a teenager, she developed chronic headaches. And so started taking ibuprofen. And for years, she was managing her headaches with ibuprofen. Tummy aches were caused by food allergies. She didn't know about that. Headaches were caused by food allergies, but taking the ibuprofen, which is a non-steroid anti-inflammatory, did a number on her gut lining. And so with leaky gut, over time, she developed more and more allergies. The toxins that were streaming through the gut lining were affecting her skin, causing the acne. And because she wasn't able to absorb her nutrients very well, that was why she had difficulty holding on to weight or gaining weight. So that gut lining is so important for good health.
Yeah, that sounds like a pretty serious condition. What causes leaky gut?
Well, when you hear the causes, you will know that, there's a whole lot of things. The first thing that comes to mind is stress. And who among us today, are not suffering from stress? When we're under stress, we have higher levels of cortisol, and elevated cortisol causes inflammation. And with the lining of the gut, if there's inflammation going on there, it can lead to leaky gut. Medicines, so especially your non-steroid and steroid anti-inflammatories, yes, they control inflammation, but they can also block the hormones, the prostaglandins that are responsible for telling your gut lining to heal.
Right.
Antibiotics, because they kill good and bad bacteria, they can cause an overgrowth of unfriendly things. And those toxins produced by unfriendly bacteria, that can affect the gut. Pesticides and herbicides, especially insidious, are the glyphosates that are used for controlling weeds when farmers are growing grains.
Mhm.
The glyphosates are herbicides, but they're also antibiotics. So they can kill the friendly bacteria in the gut as well.
Okay.
And then, of course, things like, chronic alcohol use, food allergies. So there are all kinds of things that can lead to this leaky gut condition.
Mm, okay. I've also heard of something called dysbiosis. What is that and how does that affect the skin?
So dysbiosis is an imbalance between the friendly bacteria and the unfriendly organisms in the gut. So, I like to say that, our bodies are like vehicles and hosts for microorganisms.
Mhm.
There are literally more bacteria and fungal organisms in and on your body than there are human cells, right? So we have organisms that are friendly and we call them probiotics. So these organisms confer healthy benefits, whether it's helping immunity, digestion, mood. Some of them even help regulate weight. So they're friendly ones. They're commensal organisms that they're not beneficial, but they're not harmful either.
Okay.
And then there's pathogenic bacteria or fungal organisms. And those in excess amounts can lead to problems. So dysbiosis means an imbalance. None of us, no matter how healthy we are free of organisms that are pathogenic. What we're talking about is being in balance, right? So if we have a good abundance of friendly bacteria and our immune system at the level of gut's working well, we can have a certain amount of pathogenic bacteria, fungal organisms, even a small amount of parasites, and we could be symptom-free.
Mhm.
But it's when that imbalance occurs so that there's more unfriendly organisms than friendly organisms,
Right.
then we get into trouble. And many of the same things that cause leaky gut can lead to dysbiosis. And again, back to the antibiotics, right? We have, chlorine in the water to disinfect the water. We have antibiotics that we take if we have a bacterial infection. Antibiotics, over 50% of antibiotics that are produced in North America aren't produced for human use. It's for preventing infections in our herd animals, right?
Right.
So when we eat the meat, when we use the dairy products, if those animals have been fed antibiotics, we're getting traces of those back.
Mhm.
And so what we're doing is inadvertently killing our friendly bacteria. And people will say, well, those things are to kill unfriendly bacteria. Yeah, that was their intent, but unfortunately, they also kill friendly bacteria.
Yes.
So when there's no friendly bacteria, then there's no competition. And especially with things like Candida yeast, which is the most common fungal organisms in the gut,
Mhm.
they're not affected by antibiotics. So when there's no competition for Candida, their population can balloon. And there are all kinds of people with chronic candidiasis in the gut. And again, that can lead to all kinds of problems. So when I have patients with gut problems, I want to find out whether there is this dysbiosis going on. And, stool testing, people say, oh, I've had stool testing by the doctor and nothing showed up. Well, the problem is, how is the test done, right? With COVID testing, we're doing PCR testing now. And there are labs in the US especially that do PCR testing for microorganisms. So they're looking in the stool for the DNA of parasites, worms, bacteria, fungal organisms. So if they're there in large amounts, it's going to show up. So, the tests that I do, the labs will do microscopy and they'll do PCR testing to identify, an overgrowth of these organisms. Because again, your chronic conditions from autoimmune, allergies, arthritis, neurodegenerative disorders, skin conditions, all of those things can be aggravated by both leaky gut and dysbiosis, because they go hand in hand.
Right. Yeah, you mentioned those testing. It sounds like they're much more sensitive than the run-of-the-mill test you would get through a medical doctor.
Yeah, yeah. And the other thing is that, there's something called small intestine bacterial overgrowth. If I suspect that in a patient, then I'm going to do a breath test, because the bacteria that causes small intestinal bacterial overgrowth, they're naturally found in abundance in the large intestine. So if you do a stool test, nothing looks abnormal. It's
Right.
just that when those organisms get up in large numbers into the small intestine, then they can produce all kinds of problems, from diarrhea, constipation, heartburn, bloating, right? Bloating and belching is a
Mhm.
huge symptom of a small intestine bacterial overgrowth.
And I
So
think most people would know that as SIBO, correct?
correct. SIBO is, yeah, that's the term we use for in short. That's right. And believe it or not, there's such a thing as SIFO, small intestine fungal overgrowth. Because again, usually we're dealing with candida in the large intestine, but if there's an overgrowth in the small intestine, then that's treated a little differently.
Right. And how again would that manifest, particularly with skin conditions? What does that look like?
So these people that have skin conditions, so let's say it's acne that we're dealing with, or rosacea, these people may or may not even have digestive symptoms. So if you have an overgrowth of SIBO or candida, again, usually you have digestive symptoms: belching, bloating, possibly nausea, possibly heartburn, either diarrhea or constipation, right? So when you have the gut symptoms, it's very obvious. But
Mhm.
some patients that have rosacea, for example, they don't even have a lot of gut symptoms, but what's happening is the leaky gut that's being caused by inflammation is allowing toxins to get through the gut lining into the blood. And that's what's causing the problem. So sometimes it's not even dysbiosis, but just a gut challenge. So there may or may not be symptoms. And, that's where my clinical judgment comes in. Do we do testing? How do we start approaching this condition?
Right. Okay. Interesting. One other question before we head out here is how is the association between the digestive system and the liver? How does that work?
Okay, so most people think of the digestive system as, the mouth, esophagus, the stomach, small and large intestine.
Yeah.
The liver is one of the most important organs of the digestive system. And, the liver has so many different functions. So many that I can't even remember from medical school. But the most important function when it comes to the skin is that it's important in breaking down toxins and also in breaking down hormones. So if the liver is not working very well, either from abuse, like alcohol abuse or drug abuse, or whether it's prescription or recreational drugs, then it won't do as good of a job breaking down the toxins that we're either exposed to or we produce in processing our food. And so if there's a buildup of toxins in the system, the skin is an organ of elimination. So that's going to impact the skin if the liver is not able to break down toxins. Many of my female patients that are older, they don't even remember having acne when they're teenagers, but here they are, 30, 40 years old, and they've got adult acne. And oftentimes it's either because the liver is not breaking down toxins or the liver is not processing hormones properly.
Mhm.
So if women say, my acne seems to go with my cycle. So the week before my period, I start breaking out. So the week before your period, the estrogen levels are still high. And so if a woman is not clearing estrogen effectively, then it's usually because the liver isn't doing its job properly. So with some of these women, I'm doing things to support the liver and helping the liver clear estrogen more effectively. So we're detoxing, we're nourishing, supporting the liver, and we're helping the liver clear estrogen and toxins more effectively. So if the liver is working better, it takes a load off the skin.
Right. Dr. Hollowell, when I interviewed her, she also mentioned signs of premature aging as an effect of inflammation and inability to release and eliminate toxins.
Yep, that's right. There's a term called inflammaging. And that's a combination between inflammation and aging, right? And medical doctors and naturopathic doctors that are more interested in holistic medicine, they know that inflammation is a huge part of the aging process. And every chronic degenerative disease has inflammation as part of the process. So managing inflammation reduces all the different conditions that come with aging.
Right. Well, thank you so much, Dr. Yim. I know I'm super interested in learning more. I know in particular, I'm interested, and I'm sure our listeners are interested as well, in learning more about your top skin nutrients. And we'll
Yes.
be talking about that on May 28th during our panel discussion. We've got our two naturopathic doctors, myself, and our nurse as well, Chantel, who will be answering more questions, sharing more tips, more feedback. So don't forget to join us then. Anything else from you, Dr. Yim?
No, I look forward to interacting with you guys on the panel discussion. And don't forget, lots of prizes, lots of free stuff that we're giving away. So that's always a motivation to come to this panel discussion on the 28th. So see you then. Thanks a lot, Megan.
All right, thanks.
Yeah. Bye now.
Bye.